Welcome back. The Department of Veterans Affairs says it'll incorporate artificial intelligence into the tools its healthcare providers use to take care of patients. VA's National Artificial Intelligence Institute is just one component of the agency's new digital health office. Christen MacMillan is clinical market lead at Maximus. Christen, welcome. Thanks for being on the show today. What are the tools that are available now to care providers, like folks that work at VHA, to incorporate in technology into the way they take care of people?
Yeah. So first of all, thank you for having me. Really, innovations around AI and other tech-enabled solutions have really become force multipliers across the health ecosystem, particularly in terms of solving some of the big health challenges that we're facing today. Challenges around provider shortages. I think HRSA indicated that by end of 2027, we're going to have a shortfall of about 124,000 providers, and that number is going to continue to climb over the next 10 years. And so that means providing more options and more modalities for people to get access to care. It means freeing up a provider's time to give them more capacity as well. And so there are a lot of digital tools that can help do that. And help really level the playing field for our veterans, for our military, and for our first responders. Chief among them, there are things that can make the provider's life easier. Automation in the way they collate medical records and get thousands and thousands of medical records. They spend a lot of time on administrative activities instead of spending time with their patients or focusing on where that care need is. So that's one. There's more around diagnostics, triage, telehealth modalities, and on and on.
How are you seeing some of these issues affect the day-to-day workflows of the way people provide care, whether they're interacting with a patient or doing some of the administrative work that's required to come behind those patient interactions?
Yeah. So again, I touched on the automation on the provider side of the house. But there's also tools that will help with better support decisions. This is really powerful when you're in underserved communities or working in rural areas where you need to expand that provider reach. So if you've got diagnostic tools that can more easily triage or provide some decision support for things like common injuries, pre and post deployment screenings, and maybe atypical presentations of illnesses and issues. All of those things can be handled through AI and through multiple modalities today, and they couldn't before.
I imagine it gives the provider access to information that she or he might not have had access to. 10 years ago, you had the people that worked in the office in which you worked, and that was it. Now you can access pretty much everybody through these tools, I imagine.
Oh, absolutely. And at a level and scale unparalleled. And so as our world in many ways becomes smaller, we're working across time zones and geographies. Providers have a broader outreach. They can work collaboratively, more effectively, more efficiently. That allows them to focus more on the patients, less time on the care. And even things just, going in and assimilating thousands of pages of information, or looking at, scannings, for example, and being able to pick things up that would otherwise take a human, much longer to do. It really levels the playing field.
We have about a minute left. From a management perspective, maybe I guess the step above the provider, what makes for effective management to make sure that the people that are using these tools are using them to their maximum effectiveness?
Yeah. Well, obviously they need to be trained on the tool. They need to understand the power of the tools. Some of it is fear. So really overcoming that sense of fear. This is going to replace my job, and how can they enhance their role and really provide a better patient or individualized experience with that. But there also needs to be governance as well around AI. There's always going to be a human in the loop, and you're going to need to think about things like human-centered design, and understanding where that human, that patient, that veteran, where do they fit into the mix?
Christen, it's great to have you on the program today. Thanks for joining me.
Thank you.
You can read more about digital solutions for clinical services on today's show page at fedgovtoday.com.